Why do I start with the number 774? Because that's the number I wake up to that I'm most focused on as governor of the state of California. The number of people in ICU and the number of people hospitalized in the state of California. Those numbers represent our most urgent need in terms of keeping people alive and keeping people healthy and safe in the state of California. It is incumbent that we prepare for a surge in the number of hospitalizations and the number of ICU patients. That 774 may be deceiving. Many of you may think, well, that sounds relatively modest to what's happening in other parts of this country. And that may be true. But it's incredibly important to impress upon you that that number represents roughly a quadrupling compared to where we were just 6 days ago. The number of people hospitalized in the state of California, the number 1,855, represents roughly a tripling of where we were just 6 days ago. It gives you a sense of the nature of the spread and the nature of the attack of this virus and the nature of our focus as it relates to preparing for this surge. I'll remind you that we're preparing for a 2/3 increase in our hospital bed capacity in this state. We are preparing to meet that, not just in terms of the physical needs within that system, but also making sure we have the appropriate protective gear, the ventilators, and of course, personnel, people. I'll talk more about that in a moment. So today I want to go forward with some more specifics about our modeling, about what those numbers that I've led with actually mean to you and mean to the state of California. I'll ask Dr. Ghaly here in a moment to provide an analysis of our current modeling, recognizing that our modeling is dynamic and our modeling is unique to the state of California, not necessarily trending with other parts of the country. We'll then talk about the issues of schools. As a parent, that's top of my agenda and top of mind, and I'm pleased to be joined today by Superintendent of Public Education, Tony Thurmond, and by Linda Darling-Hammond, the President of the State School Board. We'll also update all of you on some guidance we have around facial coverings, and then we will happily, of course, answer all questions you may have. But let me begin with Dr. Ghaly and ask him to come up and share with you 2 slides that give you an overview of the way we are conducting our planning exercises and how we are applying our prioritization as it relates to accessing resources, and give you a sense of where we think we're going over the course of the next number of weeks, and then well into May, potentially June and July. Dr. Ghaly?
Thank you, Governor. Let me begin by reminding everybody what we're up against. We have a brand new virus to the globe. We've been watching it and tracking it over weeks and months now, and we know that we don't have treatment. We don't have treatment at scale. We don't have a vaccine. So the most important thing we can do is stay home and save lives. We've been talking for weeks about models. We've been talking about flattening the curve, and today I'm going to talk you through how California has been looking at it. I want to remind you that nearly 3 weeks ago, we began issuing guidance, first around limiting the number of people in mass gatherings, then a few days later, issuing guidance to protect our vulnerable populations, seniors, those people who are homeless, those people with underlying conditions, and then a few days later, limiting mass gatherings even further as an indication that we were methodically and thoughtfully implementing physical distancing across the state. We then, on March 19th, issued the stay-at-home efforts across the state, augmenting what lots of local partners did as well. And it was all based on models and considerations that we've been tracking and thinking about since we learned about COVID-19. We welcomed Americans home on those repatriation flights. We took people in off cruise ships, and we prepared as a state for what we're facing today. So as the governor said, I'm going to walk you through 2 slides that demonstrate a bit of what we were up against if we did nothing, and then what we hope to be doing in terms of flattening that curve and changing the history of California as it relates to COVID-19. So On that first stay-home effort statewide, we talked about the potential of millions of Californians being infected and the need for an extraordinary number of hospital beds. This black line here indicates our surge capacity. If you added that to our existing capacity in hospitals, we would just be above this 100,000 line. But if you see unmitigated, we would need over 700,000 hospital beds at peak. That's an extraordinary number that no perfect surge plan could ever deliver. So we began immediately talking about how do we flatten this curve. This is the curve that we were worried about if we didn't do what the governor directed us to do early, which was consider all of the things to flatten it. Again, here is the same blue line if we would have done nothing. And you see it rapidly increases, even off the chart. This line here is where we project to be with our phase 1 surge plan. And if you add it to existing beds, we know that this baseline starts at about 75,000. This line represents 125,000 available beds across the state of California. When the governor speaks to 2/3 increase, this is exactly the line where we hope to be. And I'll remind you that this line builds over time as well. And we are working hard with our local hospital partners, our local counties, our local labor unions, to make sure that we not only have the spaces for these beds, but also that we have the staff and supplies to meet the need. This purple line here looks at a model of what California experiences if we do implement, and implement well, this stay-at-home effort. We know that throughout California, counties are doing an amazing job. People, individuals are doing an incredible job. I feel like I am joined by 40 million partners in this fight against COVID, and we are grateful for everyone's effort. But I want to remind you that in order to keep this line and stay to it, we need to deliver on these efforts on physical distancing. And that means holding each other accountable, working within our communities to do all that we can do and save lives. I want to point out that even in this scenario, which is not the best case scenario, this is if we do what we are doing today, we do cross this line. Our effort is to move it as far to the right as possible so that we can ensure that we have the capacity in our healthcare delivery system, not just in hospital beds, but in ICU beds and ventilators. And the governor is absolutely right. We will need more and all of these things that we can accumulate. And that's why the efforts across the state, our efforts to procure as much as we can in terms of those supplies and ventilators is very key to our ability to not just move this to the right with our own personal efforts, but potentially lift this line as well. These points on the graph demonstrate what we're experiencing today. These should not give people immediate hope. It tells us that we are doing, in 5 or 6 days of data points with our hospital data, that we are doing about what we had hoped and expected. But because these models are highly variable, they change every single day, and there are a number of different models out there. Many of you are seeing them in other settings. We need to keep an eye on these very closely to make sure that we continue to track to the model. These are the actuals, this is the model. We are always at risk of having actuals exceed the model, and we could cross this surge line sooner. And we need to do everything in our power to ensure that we keep this line as flat as we can and continue to support our communities in that effort. We will continue to be able to highlight where we are on this model and share that with you, give us feedback as a state on how we're doing in implementing those stay-at-home efforts, and it will help you understand when we bring out new considerations around on different elements of our stay-at-home effort, in order to make sure that we bring this line down as flat as we can and that our actuals track to that effort. With that, I'll turn it back to you, Governor.
Thank you, Doctor. So Just reinforces the focus of our efforts. Again, the prioritization of our day-in-day discussion interaction is the issue of hospitalizations and ICU beds. Roughly, hospitalizations to ICUs are running about 41, almost 42%. If you extrapolate that out based on the graph that was just provided in the model, we'll exceed that phase one surge capacity of 50,000 somewhere in the middle part of May. And if you get up to about 66,000, that's based upon our current modeling, we're looking at about 27,000 ICU beds that we'll need to procure in this state. The good news is we have time, and that's why it's incumbent of all of us to utilize this time thoughtfully and judiciously. And what I mean by that, continue to practice safe physical distancing.